Hey, hi, hello. Welcome to episode 101 of Trail Society, brought to you by Rabbit. I'm Corinne Malcolm,
I'm Keely Henninger.
and it is just the two of us because we just finished up a 90-minute session with our guest today. Don't worry, we're sending it to you in two parts, two interviews. We'll have Lauren Puretz, registered OBGYN from Colorado Springs, an amazing runner, on this episode and next episode, covering a whole litany of topics that you sent our way. From everything from puberty to postpartum to endometriosis and PCOS. Keely, you're training for states. I was just out on the Western States course trying to avoid poison oak. How is training going? You feeling okay this week? What's going on?
I'm finally feeling good this week. Last week I got my butt kicked. I had a big running week, which was like 16 hours of running,
I
like
saw it.
105 miles. So kind of similar to states, similar elevation, but it was over a finals week and I felt very, very tired. Like I was pretty toasted. I kept doing the math on one of my long runs of trying to make myself feel better. I was like, okay, so I increased my running volume this finals week by like 50%, and my grades only dropped by like 3%. So I think we're okay.
That's like the perfect amount of math, I think.
But it was still just like so stressful. It's also like one of the notoriously hardest blocks because it's cardio, pulmonary, and kidney is basically
Mm.
all in one. So it's like 13 weeks of content, like the most gnarly content. And of course, it's the weeks that I'm, racing 100K, training like a crazy person for 100 miles. So I'm really excited. This week we have a little down week after because basically they give you a week off to take a couple like fun classes if other people need to remediate and retake some tests, that gives them time to study as well. So this week's been so lovely to actually sleep in and get other stuff done, like doing some fun podcast recordings with Trail Society and all of us, and also sleeping, eating nice food, going to the spa.
I know you said you slept 8 hours and you were like, whoa, what is this life?
It's next level.
So Keely's brain is firing on all cylinders, even though we've
Yeah,
been talking to each other for the last 2 hours because she is slept and spa'd and ready to go.
totally. How are you doing?
I'm good. I only came back from training camp with like two little splotches of poison oak, so I think I technewed the right amount. I think
Nice.
I avoided it. That Forest Hill to Cal one, holy cow! I know why you guys came back with so much oak because it was nasty. Like I felt panicky running through it because I could see it all. And like it wasn't just off the trail, it was very much on the trail. Say honestly, there was a bunch of it like on the Devil's Thumb climb too. That wasn't so much on the trail, but it was definitely out
Mm-hmm.
there. So you guys were in it for hours in the
Yeah.
rain. So oof, Godspeed.
Yeah, it was pretty miserable,
But yeah,
but
I'm also getting just psyched to be at Western States getting to cheer everyone on. So it's the time is now. We are full Western States brain, and that is okay. Before we dive into a little bit of news and fun stuff before our interview, got to give a shout out to the folks over at Rabbit. We just had a meeting with them to talk about some fun stuff for the rest of the year, some events that we're going to be at, including events that they are sponsors and or do all the product and shirts for, including the Leadville 100 mile, that whole race series they're actually working closely with, and Javelina race weekend, things that we're super, super fired up about. But we also are continuing to work on our merch collab. Are there anything specific that you can tease a little bit of that you're excited to maybe be dawning come end of June?
yeah, just think, flowy and slightly cropped and lots of flowers and white, light colored because we're wearing it at
Pretty.
States. Pretty, yeah. And so that's definitely to come. I will say I tried the Ginger Runner shorts. They are the
Oh,
most technical shorts I've ever worn. They're amazing. So I put them on and didn't know what to fill all the pockets with. So I immediately put my phone in the back, put some gels in the front to test them out. And they're super fun. They're like a fun green with like a hot pink.
see, I thought the colors were kind of cool.
Yeah, really cool.
Awesome. So I know they sold through a lot of them, though. I think they have a few more on the website. And what you can do, which is really important, we've got a new code that is good through the end of June, and it is June Bunny, all one word. That's the month, June, Bunny, Bunny. That'll give you 10% off over on the website on anything. So go check it out today.
I love all the bunny things.
I don't know. We're little bunnies.
Little
We call
bunnies.
we always say, oh, the baby bunnies. Okay, a little bit of race news. I'm sure your feeds have been inundated by it, but it would be remiss of us not to mention it here. And that is the Stephanie Case news, i.e., Stephanie Case, amazing, UN attorney. She runs a very cool nonprofit that is all about getting women and girls in the Middle East out being active and running. Um, she's a new mom. She's 6 months postpartum. She's been very public about sharing her journey with miscarriages and IVF, and now she has got this beautiful little 6-month-old girl. She went and ran the 100K race at Ultra Trail Snowdonia to prep for Hard Rock. Didn't have a UTMB index score to be in wave one, so she started in wave three. She ended up winning the whole thing. The photos of her breastfeeding her daughter at aid stations with like baby in one arm, watermelon to the face with the other hand are phenomenal. And she didn't like, I don't think she was like worried about winning or being on the podium, but she finished and they realized based on her like chip time that she had won by 4.5 minutes. And they're like, can you go run back through the finish line again actually for us? Because you won. Surprise to her. But I'm wondering what you thought when you heard that news or if it came across your news feed at any
Yeah.
point.
Yeah, I did get it. And I mean, knowing Stephanie, I wasn't shocked by the news. She is such a crusher. But yeah, I mean, I thought it was really cool to highlight that she was able to balance that whole thing. I think the thing that I thought of the first was just like, holy cow, 6 months postpartum. That is
Yeah,
crazy.
16 and a half hour
Um,
race, just gnarly
Yeah, that's
technical.
so crazy. And so my first thought was like, okay, she got the lucky straw there of like postpartum recovery because that's
Hmm.
crazy, but also really, really awesome. And I can't imagine how hard that was for her. But then my second thought, aside from how amazing she was and how hard that was, must have been, and how crazy her postpartum journey must have been, was that how she only won by 4 minutes, but was not in the first wave. So then I was like, this is just such cool evidence for how you like can race without the pressure of
Hmm.
other people or other like expectations, right? Because she had no clue where she was. And so she's just running her own race, literally, like because she had no clue where she was. And then it ends up being that she wins. And I thought that part was really cool because it almost just like re-emphasizes running your own race, right? And not getting caught up in somebody else's. Because maybe if she was in the first wave, she would have got caught up in someone else's race or something like that. But I thought that was pretty cool too. It's like, no, she's just doing what she needed to do. She's feeding her child, she's taking care of herself, and she had no clue if she was even close to the front and still ended up winning, which is really cool.
Yeah, and in theory, like there are rules oftentimes, and people can self-select into waves that you can't get a golden ticket out of the second wave or third wave. You can't win
Mm,
the race or be eligible for prize money out of a different wave because you don't know who you're racing against then. But the she didn't opt into wave three. She
right,
was she
right.
was put in wave
Hmm.
three because of this index score. And we're actually working the PTRA or the Pro Trail Running Association is working with UTMB and
Mm,
people like Stephanie and people like Sophie Power from She Races, and other folks in the space to try to kind of like remediate some of that, i.e., work on ways to better support parents, particularly moms. This like reflects pregnancy deferral policies, but also reflects like, do we freeze index scores, for
mm,
example, to better make sure when a mom is returning to race that she is not punished for having missed, the last 2 years due to being pregnant and then being postpartum. We're gonna have a lot of examples of that with, Leah and MK pregnant and Rachel pregnant right now, with Caitlin Gerben
mm,
coming back from hip surgery and having a baby. Her baby's now 9 months old. And you put Caitlin on a start line, she's probably podium contender, but she hasn't raced for 2 years. And so it's like she doesn't have a UTMB index. And that would then punish her from, having entry into these things despite having a
mm,
pregnancy deferral in place. So we're
mm.
working on it so that that kind of stuff
Nice.
hopefully doesn't happen and other sports can utilize that
Hmm.
as well. Speaking of moms, you highlighted a really cool grant project that Strava and For All Mothers are doing. What's going on there?
Yeah, so Strava just pledged 300K towards childcare so they can get out there. Really cool tagline. Basically, this particular grant will be funding 50 small grants of $2,000 each to help offset the childcare, travel, and support costs that often stand between a mother and the starting line of races. They've also pledged to start funding research in this space and also adding lactation markers on the Strava map so moms can figure out where they can lactate during different events or runs. And so that was really, really cool. I got it in my inbox from Yuri over at Goo, who is also like kind of part of this with the For All Mothers group. and goo. And he told me to let everybody know about it. And I know, Corinne, you'd already reposted it as well. But in case you are a mother who wants to get out there, need some help with childcare, you can apply by June 14th. So you still have time.
Yeah, awesome. Please apply. I think anytime we have an opportunity to support more moms, more parents, more people getting out there, it's a big deal. You also tagged something called the enhanced games,
I
which I'm
just
sure
really want your opinion on
some
this.
people have heard about and some people haven't heard about,
Yeah.
but it's been in the news for a long time. It's not going to happen for about another year or so. But what's going on? What is this thing?
Yeah, so it's this thing is called the Enhanced Games and it's set for May of 2026, so about a year from now. It was founded by a guy named Aran de Sousa. And he is starting it with the hopes of creating a sporting environment that allows the creation of superhumanity.
I
Basically,
hate
like,
that term
I know, I
already.
know, I know, it's a little cringe. And basically, by what he means is that in these games, they will be an Olympic style games, a very original Olympic style game. So it's just swimming, track and field, and oh gosh, one more sport. Um, I don't quite remember, but
Is
you
it like
guys can.
weightlifting or something?
Oh yes, it's weightlifting. Perfect. Yep.
I
So
was like,
those three
what
sports, I was
category can
like,
they throw in
yeah.
there?
So those are the three sports, and they're going to allow different drug use, drugs that are illegal in regular sport, and actually kind of promote drug use. So they want people to break world records. Um, they're offering a $500,000 prize purse for each event.
Ugh.
250K goes to first place finisher, and they're providing appearance fees for people to come play, bonuses for breaking records. And it's just a very interesting space, and I really wanted your opinion on it. I know also this is, really a really weird space for track and field athletes, swimming athletes, because if they choose to play in this games, obviously they can't play in the regular Olympics anymore because they're willingly
Yeah.
going and
So
doping. But the
my
prize purse
question,
is insane.
yeah, my question is, do you one, it's like a reputation ender in a lot of ways, but in
Mhm.
like the broverse, the brosphere, whatever it is, oh man, Joe Rogan fans are gonna come for me. You're not listening, it's fine. Someone's gonna clip this and put it online. But it's like, are real athletes, quote unquote, gonna do this thing, right? Or is it gonna be like people from like not fringe, but like the hybrid sporting world, like type of thing that are always like, oh yeah, race me in at 200 or like I can lift more weights than you or whatever. Like, is it going to be athletes that had formerly maybe been convicted? Like, who are going to be the actual people participating in this? Because it's a weird retirement strategy.
Mhm.
It's a weird swan song for a current
Yeah.
professional athlete. You know, this is Michael Phelps coming out of retirement and just like
Hmm.
being on a lot of testosterone to make this thing happen. Like, maybe, I don't
Yeah,
know. His Mar
totally.
fans probably wouldn't like that, and his heart might explode. But
Oh.
it's just like it's a very weird swan song if you're a current professional athlete because
Mhm.
I don't think you're getting a normal contract out of this thing, right? So it needs to be
Hmm.
an exit strategy to the sport, if anything.
Totally. And I mean, he is giving them pretty big incentive just to show up, right? So he's making it so that it can be appealing to athletes who could make the Olympics. And I mean, for instance, they had already signed their first $1 million check for a bonus for beating a world record in the 50-meter swim by a Greek swimmer, Christian Glockamev, who recently got fifth in two events in the Olympics. So, he's not a nobody. He's almost podium at the Olympics, but maybe that's the caveat is that he wasn't podium at the Olympics, so now he's gonna go do this and make way more money than he probably would have at the Olympics, which is crazy. It's such a weird
Uh,
space.
this is a tangent, but I think summarizes my brain space. I just finished reading The Every, which is a Dave Eggers novel. He wrote The Circle. It's kind of like the companion piece or like the second edition, and it's about like surveillance. It's all satire, but it's
Mm,
about, you know, AI, the internet, stuff taking over. And this feels like, and it kind of feels like the end of humanity. And this also feels like the end of
mm,
humanity. So I guess we'll be on the sidelines far away trying to see what actually comes of it. I'm curious to have names announced. I want names. Like show me your Rolodex. Like who's rolling up to this thing, who's not going to
Hmm.
Athlos or Grand
Yeah.
Slam track. Like why are you coming here
Yeah. It
if you're
reminds
not a
me,
convicted doper?
yeah, it reminds me a little bit of like the Live Golf that came out, right? Where they're like, you can't play in the PGA anymore, but you can come play and live and we'll pay you more. But then you can't play in the PGA. So it's kind of like,
Yeah, or it's like,
eh,
oh, and it's funded by like Saudi
right. So I'm like, this
so,
feels a little
like
sus.
like money that like might not be good to take, like I don't
Yeah.
know.
It's
Okay, well,
interesting.
it's interesting. We digress. Yeah, if I guess slide into I would be curious how people feel about this. So slide into our DMs. Let us know what you think about the enhanced games and if it's just a gimmick with a bunch of bros or if it's like if you have a real take on it or a hot take on it, I'd be super curious to hear about it. Okay, I guess I have to introduce our interviewee for today. It's Dr. Lauren Puretz. She's amazing. Dedicated gynecologist, elite ultrarunner, mother of two based in Colorado Springs, balancing a demanding medical career with her passion for trail running. Lauren exemplifies commitment and excellence in all facets of her life. And Lauren is fast. She earned a golden ticket into the 2024 Western States. She also won the World Masters Trail Running Championships in 2024. She's speedy, is what I'm trying to say. But beyond her athletic pursuits, Lauren is a board certified OBGYN practicing in Colorado Springs, recently opened her own practice, which I think is super cool. And she's super passionate about women's health and is known for her straightforward and candid approach, which you'll hear today. We are super excited to have her on our podcast, and I'm going to step out of the way and we can dive right into this interview.
Hi, my name is Lauren Puretz. I am a physician and a mom, and I suppose I run really long distances as well.
Yeah, really long distances, really, really fast. For those watching the YouTube version of this, Lauren is recording in a closet because today's her day off and she didn't want to have to drive into the office. So we appreciate you finding a quiet space to sit down
Yeah,
with us.
I know. I'm sure a kid will bust in here at some point, but we'll try.
Perfect. We'll take it. Um, One of the most common questions that we got in our inbox when we told listeners that you were going to be coming on today, and this includes from your running friends, from your
Yeah,
training partners,
yeah.
was just like big, like, how does she do it all? You're a mother of two, you're an OBGYN with your own practice, and you're an incredible athlete. So how are you showing up in all three of those venues?
I think the the best, it's phenomenally failing at all of them, but at different times. So I feel like that's like the key to it. Because nobody can do it all at all points in time. So sometimes it's just like, oh, well, I dropped 8 balls over there, but this one didn't fall. And that is how you get through day by day. Um, but it is, yeah, it's not pretty. I'll put it that way.
Yeah, do you do the like straight from the trailhead to the office, or
Yeah.
you sneaking in a trailhead shower? What's going on there?
Yeah, so I have been lucky to have a shower in my office. Yeah, and then when I got my own office, it was like this is a mandatory is to have a shower in actually physically it's in my office now. So I don't even have to like before I had to like traipse through the entire office like in front of patients in the waiting room, like either not showered or like 3/4 of the way like showered and ready and like running to my office to like put on whatever. So now it's actually physically in my office, so I don't look as much of a hot mess. I look like I'm together by the
You're
time
like, yeah, you're like, I feel like a hot mess, but I look like things
yeah,
are moving in the right
yeah,
direction.
exactly. Or not
Sweet.
on
What?
display for everybody, I suppose.
Yeah, you're like, the mud is gone. Everyone's
Yeah,
fine. You're in great, competent
yeah,
hands. You talked about juggling balls and sometimes dropping them. So I'm just kind of wondering, as a runner, mom, physician, what does that day to day look like as far as setting aside time to do that, fitting in the
yeah.
training? Like, what does that kind of Monday through Friday actually look
Yeah,
like?
yeah. I mean, it's really down to like an art at this point. Like the night before, I am laying out what I'm gonna wear to run. I'm packing what I'm gonna wear, to work. I got my like lunch and my post run like protein shake like in the refrigerator together. So it's like no brainer, get up at 5 a.m., like fall into my clothes, eat breakfast, grab what I need. I'm in the car. So I'm running by like 6:30. And then yeah, like I said, I go straight to the office after running, try to do some sort of strength, or like I think I brought weights to my office too, so it's just there. And so trying to do some sort of strength or stretching, have the shower there. Like 90% of the time I'm like doing makeup while I'm stretching or doing lifting, like trying to like get dressed and answering questions. Like my MA will come in and she see me more naked than I think anybody else, like including my husband, because I'm always just like 0.75% ready to go, and she's like walking and I have these questions and I'm like, I don't have a bra on. Okay, here we are. But now it's just like a norm. And then, going right into starting clinic. Then after clinic, it's like, oh, time for my double. And I'll stay at my office to finish up stuff because then I gotta go pick up my daughter from gymnastics or do carpool this or pick up that kid. And so kind of just moving like a little mini headquarters in my office so I can get stuff done from there. I think while I was thinking about kind of how it is done, I think the first thing is like letting go of perfection, right? It, like I said, it doesn't look pretty. I get most of the things done I need to do in a day, most days, but it's not what it used to be. Like when I was younger and didn't have all the stuff, and prioritizing, like this can be put off until tomorrow or a week from tomorrow. And so there's definitely prioritizing there. I think one of the biggest things that I try to push on any and everybody who will listen is like forcefully, if it has to be, making your partner a partner and not a man child. And they're actively involved in all this. I don't have to adult him while I'm also trying to adult myself. And getting a partner who does that is, or teaching them how to do that is super clutch. Asking for help when you need it, right? Like, I'm not going to make it. Will you please pick up my kids from school so I'm not late? Like that kind of stuff happens a lot. Routine, organization, having badass kids who are really independent, probably because I'm such a hot mess that they have like adapted into being pretty independent, but not enabling that kind of where they're dependent on you for all the things, and then not thinking about it too much, just doing less thinking helps. Yeah.
I was
So
gonna
I
say,
think,
Keely, does this sound familiar?
Oh yeah, I have a lot of classmates who are always like, "Oh, you're so impressive. You're doing so many things." And I'm like, haven't cleaned my house in 2 weeks.
yeah,
Like there's many
yeah,
things that I'm not doing, but a lot
right,
of
right. And like,
organizing.
yeah, like we don't go out to eat a lot. We don't like, as far as that kind of stuff, but we pay for a house cleaner because that saves me a lot of time,
Hmm.
and I will cut corners in any other way. And I always sort of joke it's cheaper than counseling, like couples counseling, or it's cheaper than divorce. So like sometimes it's just about like, that's
Hmm.
something I can't do. I'm gonna hire a house cleaner because like I will cut other ways to make that happen because that's not something that I can fit into my life.
Yeah.
Uh yeah.
Yep. We
Steven's
had
already
a
trying to do that with me. Steven's like, we should hire a cleaner. And I was like, but
yeah.
then I have to manage this thing
Right. Yeah. You do have to pick up for the cleaner. You don't have to clean,
for the
but you have
cleaner.
to pick up.
Yeah.
Yeah. Which is a little
Hmm.
stressful, but it's
Yeah.
better than actually cleaning, I suppose.
I had a physician lecture to us the other day who was like, we decided to do a cleaner because we ranked what we like to do, and that's not on the list, so we're paying
Yeah.
for it. It's like,
Yeah.
if you
Right.
make it that simple, then that's a no-brainer. So,
Right. I mean, it literally is when I was in med school. My husband's a physician as well. When we were in med school, no, we were residents. We were residents. And like he's sitting on the couch. I was scrubbing the floor like Cinderella style. He like picked up his feet and put it on the coffee table as I scrub underneath. And I was like, this is the
yeah.
last time this is happening ever. And I have not done it since because I was like, yep, we are going to make this happen even as residents. We're making this happen because I'm not doing this again.
I love it. We're really excited to have you on. We're going to kind of do, I feel like, akin to the medical practice that you're in, a very
Yeah.
longitudinal
Yeah.
interviews, starting with basically like menstruating teenagers, ideally, all the way
Mhm.
until we get you on for a third episode to
Mm.
do, perimenopause and menopause. But to kick that off, I would love to hear like why you became an OBGYN, why that field, Keely's going through the thing of like trying to decide what that thing
Yeah.
is as a medical student. So why OBGYN?
So I started off, I actually thought I wanted to go to pediatrics. That changed day two on pediatrics. Day one, probably. I was like, get me out of here. I think when you look at medicine, there are surgical fields and then there are medical fields. And so that's the first big decision is do you want to do surgery or do you want to do medicine? And I wanted to do surgery. I love operating. That is like my favorite thing to do besides running. And so then I had to figure out what field within surgery I wanted to first general surgery, because that's kind of the basic, but then I just didn't really want that lifestyle, which sounds comical into what I ultimately picked, but just more of that kind of mentality, I think, of the kind of general surgery field is a little bit more rough and mean and forceful, and didn't love that. Thought I really, really, really wanted to go into urology and was like into urology, but couldn't, sorry, take the dirty old men. They were so inappropriate and so rude. Like second opinions on that rectal exam, like uncomfortable, like asking me to sit in their laps, just couldn't take it. So I really liked that OBGYN was both surgical and sort of medicine, in that I get to see patients forever from like a long, long time, right? I get to do their annuals. I've had patients where I have delivered their children, done their hysterectomies, or like, and then their mom, I also know them. And so like I have that. And so that kind of is really cool to kind of grow old with patients, I guess, in that way. But also if they have a problem, you have prolapse, you have, well, I guess pregnancy, you have heavy bleeding. I'm also the one who can fix it. So I'm the one who can do that surgery as opposed to getting them off to whatever specialist can do that. And so I really enjoyed kind of having both aspects of it, which is ultimately why I went into like found OBGYN as kind of that perfect niche of both.
Yeah.
Mhm.
I love that so much. And honestly, like my OBGYN is my favorite doctor. If anyone that treats me medically is listening to this, my OBGYN is my
Yeah,
favorite.
yeah. You were just ranked. Yeah.
I was like, why do I need a PCP? I've got my OBGYN.
Yeah.
They're the person that I want.
Yeah.
That's what I need.
Except for we know nothing above the belly button. Nothing. Like people are always like, oh, what's wrong with my? And I'm like, I have no idea. Like your ankle looks swollen. You should probably do something about that. I don't know. Don't ask me to look in your throat and your eyeball. I have no idea.
You're like,
So that's why you need a primary.
can't help you there.
But then
Yeah.
when it comes to generalized symptoms due to, and again, we won't dive into this today, but generalized symptoms due to perimenopause or menopause, then general doctors have no clue, and
Yeah,
you have a lot of
exactly.
ideas. So it flips after a certain age.
Yeah, it's right. Most definitely. Yeah, yeah. There comes that point where they don't have that expertise, and then I am happy to jump in. But yeah, don't ask me to manage your cholesterol. I won't
Yeah,
know what to do.
you're in this position now too, where it's like it's very possible that you've performed someone's first pap smear, and it's like you
Hmm.
could very likely like deliver their child and then
Yeah,
like
yeah.
take care of them. Like you're gonna have patients that you have seen
I
for
know.
a long time, and we think of OBGYN as like, oh, the person you see when you're pregnant, but you also see younger
Hmm.
people. And
Yeah,
so what's that relationship like working with younger patients, younger athletes as an
yeah.
OBGYN?
Yeah. I mean, I always joke that I love the transitions. Like I love puberty and I love perimenopause, menopause. I love those changes. I love seeing little girls. I know my first gynecologic experience was horrific, awful, hated it. And I hope to never um be that. I know I am just somewhere right above or below the dentist, and I'm totally accepting of that at this point, that no one's excited to see me. And if you were excited to see your gynecologist, might be a little bit weird, but it shouldn't be horrific. You shouldn't be scared. It should be like, yeah, not my favorite thing, but it shouldn't be like something you avoid. So I love being that kind of first person to be like, you're in charge here. Ultimately, we can do a pelvic, we cannot do a pelvic, we can just talk, we cannot talk. And also kind of giving them that like know your body so you're in control of your body and you're not ashamed of your body and its functions. And so I love trying to give that give that little by little to each patient I see, whether they are like I said, their first menstruals, or that athlete who is kind of trying to figure out everything in kind of that area, or even just your regular appointment. I like trying to give them a little bit of empowerment in there, that like we don't have to be ashamed of our bodies or ourself, whatever that may look like. So that's kind of my favorite part. It kind of stinks that I'm usually stepping in when there's a problem, especially for younger girls, right? Because they're usually going to their pediatricians, and don't come routinely to me until they're older. So that's kind of a little bit of kind of a problem in the system, and that hopefully most pediatricians will be on board with all this as well. But yeah, I usually am also, for most kids, kind of stepping in when there's a problem as opposed to just general preventative stuff.
Well, it's interesting too, because right, like puberty, like you got this mashup of all those things, right? Puberty, athletics, their first period, or their period not coming, or their period being
Mhm.
irregular. And is that puberty? Is that athletics? You've got this like crazy Venn diagram
Yeah.
puzzle to solve. And so we were wondering, are you seeing any trends in how, or either personally in clinic or via the literature that you're exposed to, trends in how early or late girls are starting to menstruate, particularly like in relationship to sport these days? Like, has
Uh,
that changed since we were menstruating preteens or teenagers?
yeah, right. Yeah. So, as far as the general trend, younger is actually what we're seeing. But in athletes, that hasn't changed too much, and that they tend to be later on that scale of like everybody else is moving, earlier. They're not moving, they're kind of staying the same ish or later in some cases, unfortunately. But yeah, mostly earlier, the general trend.
And do you think that, like, is that just like lifestyle factors, right? Like, we're thinking like general trend earlier, maybe lifestyle factors, athletes later, maybe lifestyle factors. Is that
Yeah.
kind of the general consensus?
Yeah. And I think there's some worries about kind of exposures, whether it's in food or in uh, things you're in contact with, clothes, etc., that could be impacting that and changing those hormones. But yeah, lifestyle comes in there as well, as far as um, like more obesity in children kind of leads to earlier puberty. Uh, but
Yeah. And I guess maybe building off that, a better question for our audience is more in line with, okay, you've got a teenager, maybe this is when they're coming into your office. They're 15, 16, 17. Their parent or coach has flagged like, hey, like you're not menstruating. That's like a
Mhm.
little bit unusual. And historically, like I remember this when I was in high school because I had a lot of teammates who like were not menstruating. And, the band-aid for those, like for either their period going away or them not having gotten their period, was
Yeah.
to prescribe hormonal birth control, to
Mhm.
like be like, okay, this is going to be the boost you need to quote unquote get your period. Like, is that still the standard of care? Has that changed at all? Are you thinking about that differently?
Yeah, I mean, yes and no. So, I think it used to just be kind of like, oh, Band-Aid, here is that estrogen. I mean, ultimately, you're kind of giving them the estrogen they don't have, or they're not producing on their own. And as far as a lot of like, you know, function in the body that can be detrimental, short and long term. Um, but I feel like now it's a little bit more recognized to say, hey, like that's what I can do in the 15-minute appointment you have, trying to throw in there, like, here's what healthy, fueling is for your activity, your exercise level. But we need to get a team here of, yeah, your coaches, your parents, and maybe even dietitians, depending on how severe it is, all involved, as opposed to just here's a band-aid, have a nice day. I think there's more recognition and more of that kind of community, not community, what's the word I'm looking for, multi-specialty kind of helping to get that person, that athlete, to a healthier state as opposed to just the band-aid. So that's a really good trend that I feel like I'm seeing.
Yeah, like recognizing that it is multifactorial, but it
Yeah,
needs to be kind of all hands on deck to address like any potential underlying
right,
reason as to why the athlete might be in that state is
right.
mega. That's a
Yeah,
good change.
right. And the amount of like times it's a coach referring an athlete, or a parent who's maybe concerned, than it used to be just like the pediatrician being like, I don't like this, right? I don't know what's going on, send them on. And that's really reassuring too when you see like it's the coach isn't enabling that as like a positive thing. They're the one calling it out and saying, nah, let's figure this out. Let's get this person help from wherever we may need it to be.
Yeah. And I mean, I think that's a trend that we are all very happy with
Yeah,
here.
yeah,
I
Totally.
guess, I kind of just want to talk about birth control a little bit as far as
yeah.
like some common concerns. Are there big, like in your office when people come in to talk to you about birth control and their
Mhm.
options, are there any current like trends when it comes to fears about birth control or concerns that may be rational or irrational or founded in
Yeah.
science or not? Like what does that conversation look like? What are you seeing in your practice?
Yeah, I mean, I see it a lot. I feel like the biggest thing I I feel like I'm battling TikTok more than I'm battling anything else. A lot of misinformation out there. I think it's also really odd that I see people think the pill is bad, terrible, horrible, can't be on it. This is, not good. But hormone therapy is having its moment. Everybody should be on hormone therapy. They're the same hormones. Like it's literally the same thing. Uh, but I think the way people think about them are two very different. And yes, they're used in mostly different ways, but not really. Like my office, I call anytime I prescribe estrogen, progesterone, or both, I call it hormone therapy. I don't care if we're putting you on hormone therapy to prevent you from getting pregnant. We're putting you on hormone therapy to protect your bones from amenorrhea or no periods. I'm putting you on hormone therapy because your periods are really heavy. I'm putting you on hormone therapy to control your painful periods. I don't call it the pill or I don't call it birth control because it's not just that. And I think that has that kind of negative implication or that negative like it's bad, whether it's because parents think their kids don't need birth control, right? Which, okay, fine if they don't, but they do need their period controlled because it's really heavy or painful or whatever it may be. And I find that if I phrase it like that, people are a little bit more keen to proceed with treatment than if I were to call it the pill. And ultimately, they're always like, wait, isn't that just the pill? And I'm like, oh, yeah, it is. That's what we kind of call it. But it's hormone therapy. And yeah, it's, overriding your natural menstrual cycle, which sometimes that's what's best for you. Not always, but for some people, that's what's best. Um, it's making you not ovulate. And that's what ultimately the problem is when we come to something like relative energy deficiency in sport, right? Is that people aren't ovulating. And so those estrogen and progesterone is really low. So it masks some problems there, but not if not everybody's dealing with that. If there's a whole nother issue we're dealing with, like I said, all the other menstrual problems you can have, it can be really helpful and not bad, not dangerous. Um, there's a little bit, I think it's a little bit better, but you still see some people afraid of like breast cancer risks in young people on the pill, which is pretty low. So not really a concern that early. Um, but yeah, it is. I feel like I spend more time explaining why the pill isn't the devil than anything else in my office.
Yeah, and
Mhm.
I mean there are a lot of conditions where it's like, if we're going to talk hopefully a little bit about endometriosis and PCOS, and for
Mhm.
those individuals, like the pill, like hormone
Yeah,
therapy in that regard is like the one thing that keeps them sane
right.
because they're in so
Yeah,
much pain and discomfort. So
right. Yeah.
when you talk about masking a little bit, that is a common question that we get from folks, particularly either they're on oral birth control, and so they're not sure if they're getting their period or not because
Hmm.
it's a withdrawal from that change in hormones, or
Hmm.
they're on like a progesterone based IU yeah, IUD, and um they are worried that, a X percent of people on a progesterone based IUD don't bleed because they're not building
Hmm.
up a uterine lining,
Yeah, yeah.
which might be great for some folks, but
Yeah.
it masks our like, our canary in the coal mine ability of
Mhm.
being like, oh, something's off because my period's becoming irregular. Is there anything that people can do in that regard to kind of like watch out for red flags if they
Yeah.
if they're masked in any way?
Right, right. Yeah. So definitely like the withdrawal bleed from uh the pill is not an indicator that things are good.
Hmm.
Uh and so doesn't kind of give us that like, is everything okay? I always say like, um your period is a vital sign, right? So that regularity of a period is telling us, it's a sign that everything is okay. Uh to kind of without that bleed, the best ways indicators mood, irritability, sleep, like if you're having insomnia, loss of appetite, which can be difficult already if you're dealing with that as a problem because you're like, oh, I'm not hungry. But loss of appetite, loss of libido, decreases in performance can also be there. Not recovering, I should say, like you used to be able to. If you wear your watch overnight, your decrease in HRV can be an indicator. Having more injuries would be an indicator. Again, that not recovering or having more chronic injuries, fatigue. So, in general, fatigue can be there. A lot of GI symptoms can also be from the lack of kind of an ovulatory cycle. Bloating, constipation would be ones that you can look at. It's going to take more kind of being in tune with your body than just like, oh, bleed. That's pretty obvious. So it's a little bit more nuanced and a little bit more dedication to making sure things are okay than with not being on the pill. With the levonorgestrel or the Mirena or Kylena Liletta with the progesterone IUDs, you can still ovulate, so it doesn't reliably prevent ovulation. And so you can actually track ovulation, whether you feel ovulation or doing ovulation predictor kits. You can still see if you're in an ovulatory cycle because it's not the bleed that's telling us, that's not the
Hmm.
vital sign, that's just the external kind of
Hmm.
indicator of it. It's that you're in an ovulatory cycle, that you're ovulating, and that you probably most likely are still ovulating with the IUD. So you'd be able to monitor that with like ovulation predictor kits. I
Hmm.
call them OPKs. Those will tell you if you're having your LH surge, which is an indication of ovulation. So you can still do it that's a little bit easier with something like the Marina.
Hmm. And so, like, if you were on that IUD and you had an Aura ring, just for someone who maybe wouldn't want to buy a kit that tracks LH, would you
Yeah.
also see the change in temperature with
Hmm.
ovulation? Yeah.
Absolutely. Yep.
So they could
Yep.
look that way.
Yep. Cervical mucus, probably not, because that's one of the ways the Marina works. I say Marina as like the lip balm or the chapstick of the Marina for all those progesterone IUDs. Thickened cervical mucus, that's one of the ways it prevents pregnancy, so sperm can't get into the uterus. So cervical mucus, probably not, but basal
Hmm.
body temperature
Hmm.
should still be an indicator. Yep.
Nice.
Yeah, it's like we're always looking for that thing because you're right. Like it's harder to maybe tell the low energy availability. And this is not a question, just a little aside about being in tune with your body. Like, I don't know if you saw the news that Sabrina Stanley ended up having surgery. She caught an ovarian mass super early.
Mm,
She had identified ovarian cancer. And I think in part, it's just like, as athletes, we're crazy in tune with our body. It's
yeah.
one that does not get caught very early, very often, and can be incredibly scary because of it. But it sounds like,
Hmm.
she's going to be okay. She doesn't have to have chemo. She'll have to have a second surgery at some point to
Yeah.
like remove other potential like cancerous tissue that they're worried about. But it's like that athletes are extra in tune,
Yeah.
I think,
Yeah.
and
Yeah.
you got to listen to that.
Yeah, exactly. And like I said, it takes that extra to do it. But your body will tell you, right?
Yeah. We had a question that that was sent in to us, and it was about kind of cycle variability,
Hmm.
i.e., like, we know that cycles are generally within a ballpark of, whatever, 26 to 35 days or something.
Hmm.
And people generally find themselves kind of more or less consistently at a certain pattern. And their question was about, how normal or not normal is changing of the cycle. And it sounds like their cycle, for example, had gone from being pretty consistent 28 days to kind of all of a sudden they had their period at 23 days. And so is there anything that athletes should be aware of when it comes to like normal variability within a cycle versus like,
Hmm.
ooh, like all of a sudden my cycle's gotten really long or my cycle's gotten really short? Is there any like red flag that they should be going into to say, hey, I'm gonna go see my OB-GYN about this.
Yeah, yeah. I mean, it's hard because like your cycle is very sensitive to all the things.
Everything.
Yeah, stress, sleep, obviously, energy availability, like it's in tune with all that kind of stuff. And so you can have like a fluke what where it's kind of off. Yeah, generally speaking, your period is gonna be if it's predictable, right? So you're like, oh, within a day or two on either side would be that predictable. If it happens once where your cycle's off, I really wouldn't worry about it too much. Something happened, right? Who knows what it was? As long as that's not a repeated thing, right? So yeah, you had a big race or a big stressful event, a move, whatever it may be, change of careers, whatever it is, that may be off for a cycle or two, but then it should get back in. And even if it is off for a cycle or two, that's probably not going to have long-term implications. It's just your body, like, I mean, ultimately, your body's telling you whether it's safe to get pregnant or not, right? I mean, I hate to say it, but that's the job of the female reproductive cycle is to get pregnant every month. You don't have to get pregnant every month, but that's its job, right? That's what it's there for.
Yeah.
And so when you're not able to get pregnant or your body's not ovulating, that's the red flag. That's your body telling you something. One time, just like anything, right? You can have one time, it's a fluke, and then you get right back to regular, not a problem. It's when it's consistent, right? Like this has been going on for more than one or two cycles. That's when you'd want to go see if something's going on, right? Could be your thyroid's off, could be, like I said, the energy deficiency or whatever it may be. You can even have something like a polyp or a fibroid. You know, like there are things that can not be kind of dangerous for performance, if you will. But I would say one time flukes, don't worry about too much. If it's a pattern of no pattern, then that's when you need to be more concerned.
Mhm. Yeah, I've
Gotcha.
had an athlete who's been amenorrheic for a while and is now being really consistent with their cycle, which is awesome. But they always ask me, like, kind of at that point, what is the range I should be looking at to be considered regular? And I kind of had to talk with her and say, I think if you see these trends happening, like even if you have one cycle that's, goes from 28 to 33 days, it's like, okay, one cycle doing that, not the worst thing. However, you have to ask yourself, what am I doing? And if
Mm-hmm.
you can't have that conversation with yourself and not acknowledge that maybe you are really overdoing it and the trend is gonna keep continuing to
Right.
lengthen, then that is a really good red flag. But you kind of have to have that conversation with yourself
Yeah.
when it's late, right? It's like, oh, is it late because yeah, I had this crazy week where I was moving and going across the country or whatever?
Yeah.
Or is this because like slowly I've been overdoing it and I'm gonna
Mm-hmm.
keep overdoing it and this is gonna become a problem?
Right.
I
Right.
try to like talk to athletes that way so that they actually will question what they're doing in a bigger picture, but obviously it's not the easiest conversation to have.
Yeah. Yeah. I had that conversation with a patient recently, and I mean, I have it, I guess, frequently, but it's that like really awkward conversation where I'm like, I can't, I probably will not be able to pinpoint one thing that happened that caused this one period or this change. But I need you to go back and kind of think about things and be honest with yourself about what has changed, what's going on that could be doing this. And I think we were kind of talking about, uh, athletes being more in tune with their body. I think we're also really good at ignoring a lot of things and
Mhm.
pretending all is well, and oh, that's fine, everything's fine, like I'll just keep doing that. And it's very hard to balance that of like, I think that's why the periods are so helpful, uh because it's a big obvious lack of, sorry for the pun, red flag, right? Like there it is, everything's good. Oh, there it's not. And so uh as we are more in tune, we're also very good at ignoring and being able to kind of walk that line without being um too critical, but also not ignoring anything dangerous is hard.
I think that ties really nicely into this. Keely, you posed that kind of first fertility question, and it has to do with like abnormal cycles or amenorrhea. Do you want to hit that one?
Yeah, this is something I've been thinking a lot about lately, and I'm actually doing a lot of research on going forward. But I've been thinking a lot lately of how a lot of female athletes across many sports will, compete in their sport during a lot of their major reproductive years. And a lot of athletes, not all of them, will experience periods of amenorrhea. Some athletes will have amenorrhea for years. And we keep, putting in new contract bylines to support women during pregnancy, to support athletes during IVF, all of these things without knowing how chronic amenorrhea or chronic overtraining impacts future fertility. And so I was just wondering if you've had any, either anecdotal experience in this space or experience in this space from, yeah, patients or research that you can think of in relation to, yeah, athletes, amenorrhea, energy deficiency, and future fertility.
Yeah, I mean, I think it, I think the sad answer is yes, it can impact your fertility and it can impact your fertility long term. I think it depends on how long you went being amenorrheic or energy deficient and how it was treated. That we're seeing that. Some people, yes, will ultimately maybe need fertility treatments or to see a fertility specialist. But some people are able to get pregnant. But I think it really just, like I said, depends on how long. But yeah, I'm seeing long-term impacts of that.
Yeah, which is like that is so wrong, right, of our system to allow that to happen when like that is a really awesome privilege that we have as females is to be able to create new beings and
Hmm.
to knowingly, push females to the brink of breaking where all of a sudden we're impacting their ability to do that in the future. These girls who could be 13 years old and have no concept of that, right?
Yeah.
It's such an injustice. So yeah, I'm really interested in that space because I think nobody's really touched it and we're trying to touch it from the outside, like kind of
Mhm.
like poking at it, like, ooh, maybe we'll support their IVF, maybe we'll support them post-pregnancy, but we're not actually understanding if the system's breaking them before we're even able to support
Yeah.
them through that. And so yeah, it's
Right.
really interesting space.
Yeah. And I think it's just really unfair, if I'm being honest, that our ovaries are like, why
Time
can't
sensitive.
Yeah, why can't they just work when we want them to work? Like, even if it's not an athlete, like I'd like to have a stable job and a income and a home before I start. Oh, and that's gonna be, I mean, I'm 40. Cool. Like that's when my ovaries are, about to retire.
Totally.
And it's just so unfair, like whether it's athletes or whether it's life in general, that the time that's best for females to start a family is the time when your ovaries are like hard pass, and it just sucks. Um, and freezing your eggs freezes you in time, right? And so you're able to have that extended reproductive time frame, but that's not an easy process either,
Mhm.
right? It's still,
Totally.
we're basically hyperstimming your ovaries to then surgically remove eggs,
Hmm.
potentially fertilize them, and then freeze them. It's not like a nothing cycle, a nothing time
Right.
energy.
Right.
Yeah,
And there's no guarantee that those embryos will implant later either.
Right? Yeah.
Yeah.
yeah, I've been thinking about this a lot, but I do think like touching on the egg freezing thing, and then I'll back up for a second about fertility in general. I've had a number of athletes go through this. I've had a number of friends go through this. I'm of the age where it's like I've got all kinds of friends freezing eggs, but
Mm-hmm.
just like from an athletic standpoint, because it's you've got hormone injections, you've got a retrieval, you've got ovaries that are all of a sudden really big for a hot
Yeah.
second and are maybe not comfy, and you can harm if you like are too like I've got to train because I'm doing this thing. Talk to us a little bit about like what does that actually mean? Freezing eggs seems so nebulous and so laissez-faire in a lot of ways, but I know it's not. I know it's a whole procedure. So what do athletes need to know if they are considering going through that journey as far as like what it might be like that like
Mm-hmm.
time expectations and like coming back to run post egg retrieval?
Yeah. So, I mean, it is a really difficult, whether it's IVF or because basically, if you think IVF, or when you are getting eggs, if you will, that's the same process. The only difference between freezing your eggs and IVF is after they get your eggs. For IVF, they just inseminate it and put it right back into your body so quickly ish. Whereas with IVF, they're then, whether they're freezing the eggs or the embryos, is going to, so it's really almost a very similar process for the female, shy of the implantation. It's like daily ultrasounds, daily blood tests, monitoring to see when are we ready to harvest these eggs? Because if you're going to do it, they're going to want a lot, right? Like you don't want to do this whole process of like, we got 3 eggs, because there is attrition as you go through, right? We got 3. And whether you inseminate them or not, some may not inseminate, or when you freeze them, some may not be alive when you unfreeze them. So there's attrition at every step. And so they're going to want to get as many as possible. So they're going to go just up to as hyperstimulated as possible to get as many eggs as possible, which means your ovaries are giant, and high risk of torsion, high risk of pain, high risk of what's called hyperstims, which is basically a hypertensive crisis. So it can be quite dangerous. And then you get to go to a surgical procedure where it's like going to the gynecologist, except for just a speculum. They put a giant needle through the vagina and into the ovary, and then one by one pull out, at least back when I pull out an egg, and then they send it to the I got the name of the person now that I'm thinking about it. Like there is a person literally there, grab the egg, that pathologist looks at it, makes sure that the egg is okay, next, right? And it's a long process, just even that. So pretty uncomfortable. And whether or not you're going to go to get pregnant or you're just freezing them, your ovaries have to heal from that afterwards. So it's a process, and it's not as just like, oh, let's just do that, right? And then you have the cost of storage. Like the procedure
You're
is
paying
almost,
rent.
you are, and it's expensive. So you think like, oh, cool, like they'll cover the cost of the procedure, I'll cover the cost of rent, and it's a lot. So that can be, a cost there too that can be prohibitive. But yeah, it's going to take some time to recover from that procedure, probably at least a couple weeks before you start wanting to run again.
Oof. I guess, yeah, you're like, yes, let's go do it. It's pricey, it might hurt, and you're going to take some time off. But
Yeah.
for a lot of people, right? You talk about career, athletic goals, all that stuff is all hitting in the same time frame. So modern medicine is allowing people. Marin County and San Francisco have the oldest average age of first-time mothers.
Really?
Yep, in the country at like 32 to 35.
Okay.
And so it's like it doesn't sound that old. I'm 35. It doesn't sound that old, but it's like in comparison to the rest of the country, it's a very different
Yeah.
atmosphere. I want to talk for a brief second about navigating the fertility journey with your patients. Like I'm 35. I've been public on this podcast about like wanting to start a family. We're at the point where we haven't turned over every rock yet to be like, maybe
Yeah.
this is wrong. What's wrong here? But we've been trying for 6 or 7 months, and I am
Yeah.
presently on this day not pregnant. You never know.
Yeah.
I'll get my period in like 10 days or not. Now you can all keep track at home as
Yeah,
to
right.
when I'm menstruating. But like, what would you recommend kind of for someone coming into you saying, this is for my own personal
Yeah,
knowledge
yeah.
and safety? What are those first steps as far as like, okay, you're dealing with some fertility stuff. Like what can athletes or patients or humans be looking at when it comes to like kind of starting to evaluate their fertility pipeline?
I think first and foremost, 'cause I think shockingly, a lot of people actually see me because they're just scared, nervous about it, even though they're not actively trying. And I think the first things first, if your periods are predictable, it's kind of the poor man's fertility test. You're likely ovulating. You're probably fine. So that's kind of first and foremost. The second thing is, and I did this study, the rate they got this is they did a study on like I think an Amish community, and how long on average did it take them to get pregnant? So kind of taking out a lot of factors in there, and it took on average 12, not 12 on average, sorry, up to 12 months to get pregnant without there being any other concerning things, right? Like red flags that something else was going on. So it can be totally normal to take up to 12 months to get pregnant without any concern. So that's the other thing when people are like, why didn't I get pregnant? It's been 1 or 2 cycles. And I feel like most people think of pregnancy as, oops, I accidentally got pregnant. I wasn't even trying, which I swear that's how you get pregnant. If you stop trying, boom, you're pregnant.
Oh, I started signing up for events because I hadn't
Yeah.
signed up for anything because I was like, I
Yeah.
can't sign up for anything because I'm gonna be pregnant. I'm not gonna
Yeah.
race. And now I'm like, I just threw a bunch of money at races in the last
Yeah.
couple of days. So I'm like,
You'll be
it's gonna
pregnant in no
happen
time.
now.
Yeah, you'll be
exactly.
pregnant in no time.
Make
Like
plans, you'll get pregnant.
Is there
plan
a
to
study
go someplace where you can't go, like go to France. We're
that
like, oh,
you've
I'm
never
gonna go on
been
the
or
line.
something?
What's that?
Someplace you've never been, and then, oh
Yeah.
crap, I can't go.
Yeah. Now you'll be pregnant. So I
Lauren,
don't know
is
what that
that
is.
are those
Uh,
guidelines new though? Like, is that study on the Amish people around
Forever old.
pregnancy timeline? That's what I'm like. We probably need
Forever.
some new studies.
Yeah.
Yeah,
Now I say that, and that's saying that there's nothing wrong. Now,
true.
that's so you have a regular, predictable cycle. Don't panic if it takes you several months to get pregnant, even up to a year, not terribly concerned. And as far as the guidelines, we still don't start infertility testing until 12 months. If if you're under the age of 35, if you don't have any risk factors like history of pelvic inflammatory disease, unpredictable periods, painful menses. So there are risk factors that say don't wait that long, right? But if you're like 25, periods are predictable, have never had any pelvic infections, don't have painful period, painful intercourse, and that might be concerning for endometriosis, we're not going to start that infertility workup at this point then, right? But if you're over 35, we would maybe give you 6 months at most before we'd say we should probably look into things. So if there's any reasons why we think you're not getting pregnant, we're not waiting that full 12 months.
And question here too, because it's always, it feels like it's always the female bodied person's, the person
Mm-hmm.
with the uterus, it's always their fault, maybe. But can we just like point out too that it's like it takes two and that there is like sperm involved in this whole
Oh,
process and like that has to
30,
work too?
yeah, 33% of the time it's male factor. Yeah, we're way more complicated. They're real simple. They literally have to give a semen analysis, one thing. That's all they have to do. And
Works
we can,
doesn't work.
yeah, 33% of the time it is. And the amount of time I have to, I'm not really begging. I have to like beg them to get it done, is unreal because they are, for some reason, men or people with penises are very resistant to that. But yeah, third of the time it's or more, yeah, third of the time it's men. And so that would be included is that semen analysis. But I don't see men.
Yeah, not your ball game. That's someone
Yeah.
else's
Yeah. So I order
problem.
semen. Yeah, I order semen analysis. I do that part. But I don't I usually get the women who come, the female who come complaining or worried, I should say, about fertility. So those, yeah, so you have your red flags there. That's like, we're not waiting that long. And a lot of women ask for like AMH or anti-Müllerian hormone testing, which I don't disagree about getting it, but it's a snapshot. It's not like, oh, this is good. You're good to wait for whenever you're ready. That number changes too, right? So I frequently have women come in and who are like, I just want to make sure everything's okay so I can go about finishing my degree before I have to worry. And I'm like, sure, we can get this, but I don't want you to think that this means everything's okay.
Mhm.
This number can change, which means that this number now is quite useless for when you start trying in 2 years from now.
Mhm.
But it may make you think, oh, nope, this number's already starting to be a little bit decreased as far as AMH. Maybe I should be a little bit I should change this around or prioritize things differently. So it can do that. But if you're like, well, I'm not going to get pregnant, even if that number is abnormal, then the utility might be pretty low on getting it done. But the nice thing about AMH is it can be done at any point in your cycle, pretty easy. It's trying to get at egg quality. There is no good test for egg quality. There's
Mhm.
a lot of very poor tests that can aim us in the direction that we've got good eggs, right? When it comes to fertility, right? First, you have to have a good egg. Second, you have to ovulate. Third, it has to have a path to meet a sperm, right? And then fourth, I suppose it has to implant. So if you are ovulating, great, but your eggs are older or even at a younger age, they're not functioning properly, which means when they're inseminated, right, that division of cells to make a human, that mechanics is not good, right? That egg quality is not good, then you have a higher chance of not getting pregnant at all or miscarriage. And that quality is what's hard to get an exact measurement of. Antral
Mhm.
follicle count, AMH, a cycle day 2 or 3, FSH is going to be helpful in pointing us in the direction that it looks good or doesn't look good. So like I said, nothing's perfect, but an AMH, if it's going to change what you do, then get it done. And it's easy to do at any point in your cycle.
And I think I've got maybe one final question. Like basically reflecting this idea of like that's a lot, right? Fertility is a mystery. You've done that, right? You have two kids.
Mhm.
But just like what do you know now as a practitioner, as a mom, as a runner that you wish you knew 10 years ago, 15 years ago?
Um, I think, uh, and I hope my kids aren't in range to hear me. I think two things that I think of. I wanted to be a mom, but I also kind of grew up in the Midwest where I think I thought that was like what you're supposed to do. I think it's kind of awesome now to hear people being like, oh, I don't want to be a mom. I don't need to be a mom. I don't have to be a mom. And I kind of, not that I don't know if it would change anything, but just that concept of like women now being like, I've decided I want to, or I've decided I don't want to be a mom. I don't think I ever thought about that. I thought I had to be. Does that make sense? I don't know if that is, I'm trying not to be mean. Not that I don't like my kids or don't wish I didn't have kids, but like, I don't even think I contemplated that. And I think it's kind of amazing that I hear that more often, that women feel like they don't have to be, that's not their only role in life is to be a mom if they don't want to be. So I think that's one thing that I just wish I would have thought about at some point. Um, and the other thing is it's not a race to get to be a mom. Like I could have done it later in life. I kind of have that like, should I have put running like and done it earlier in my life and then put off being a parent to later, as opposed to I did med school and parenting and then I decided to start running competitively. And should I have flipped that? And that uh it's a possibility. I did my infertility. So I did like I really actually loved infertility. A lot of OBGYN generalists don't do it because I kind of like it. So I did a bunch of infertility, like extra months and rotations. And I freaked out that like, oh no, I'm infertile because you see people who have no risk factors, everything seems, and they can't get pregnant. And I panicked and I was like, we're getting pregnant tomorrow. And so just even that, like, or not, I guess not having that knowledge or having that like, it's okay, you can wait, you can like prioritize things differently, and that can still happen for you. I think those are the two biggest things that I wish I kind of thought about when I was younger.
Yeah, it's hindsight is 2020.
Any, right? I know.
Well, Lauren, thanks for like sitting down to chat about, you know, birth control, fertility issues, all that kind of stuff. I think it's going to be super helpful for a lot of folks.
Yeah.
Okay, well, that was round one with Dr. Lauren Puretz. We're having her on for round two for episode 102. So if you enjoyed her this time around, you're going to enjoy her again next time around. We really couldn't fit it all into one episode. So we're excited to have her back on the podcast. But as always, super fun, super engaging, super educational. Keely, how fired up are you about women's health right now?
Oh, I'm so fired up. She validated my current research agenda too, so we're good.
I love it. Okay, well, it is everyone's favorite time. We're going to dive into Society Slam. But before we do so, we have to remind you, you should go over to the Rabbit website, Runnin' Rabbit, and you should go find some fun new summer attire. If you can grab a pair of the Venture shorts before they're gone, I would highly suggest you do so. And again, you're going to use that code June Bunny, all one word, to snag an extra 10% off. Okay, Keely, what's our first slam?
All right, we got a nice message from a listener here. Hello, thanks for answering my question. I'm an endurance athlete. In response to the listener, tired of hearing only about the men, I wanted to plug a young woman I know from the Madison, Wisconsin area. She ran track in college, experienced the all too common situation of suffering a terrible knee injury, being pushed right back into training too soon, and ruining her college career. She graduated and had a very well-paying job. She bought a van, was able to do her job remotely. This job was not matching what that means most to her, so she quit and has now made it her mission to bring more women into the outdoor sports. She has a new podcast, website, and Instagram called Get Stoked Girls. For being new and young, I think her podcasts have been great so far. She's running Leadville this year. I know I often feel badly that I know more about male runners than female. So then I remember it is not my fault when most of what we hear and are shown are the men. So thank you. I just wanted to highlight this woman. Thank you for sharing.
That's
We'll
so
have to check
cool.
her out.
We'll
Yeah.
have to check it out. Maybe we've got a new podcast guest amongst us. Excited she's gonna be at Leadville too. That's
Yeah.
super sick. We'll have maybe that's my co-conspirator for a Leadville shenanigans. I
There we
like
go.
it. Okay, I'll take these next two because they are super short. First one is just congrats on 100 episodes. I actually told Steven that we just did our 100th episode. He's like, "What? You didn't tell me. That's so cool." So we did it. We made it to 100. Here's 101. They said, listening is always a highlight of my week. Thank you for being inspiring, trustworthy, and welcoming space for women in trail running. And the second shout out is just thank you so much, Corinne and Hillary, for being so kind during the shakeout at Tiger Claw. We had a legit blast. Congratulations to Hillary for crushing the big cat and winning. It was a pleasure to see you at the finish. Finished the ascent at the top as we were volunteering up there. And of course, I finished much later in the 50K, but so happy I got to see you two and appreciate what you bring to the trail community. Your voices, words make a huge difference. Keep flying high and being great ambassadors for our sport. Looking forward to catching up on the podcast and the live broadcast for Western States, Broken Arrow, Sky Races, UTMB Hard Rock, and so much more. Thanks for listening. That's so exciting. And join us next year at Tiger Claw, maybe. It's in my backyard and it's pretty darn sick. I guess that's it for today. Thank you for hanging out with us. If you're still running and listening, eat a snack right now. No questions, no takes backsies. Go eat a snack. If you're not running, maybe skedaddle over to Apple or Spotify and leave us a 5-star review and tell your friends about it. Until next time, we'll catch you out on the trails. Oh, I have to hit and record. It's me.
Yeah.
Oh, man.